A very warm good evening, everyone. My name is Vidhu Bhatnagar, and I'm going to talk about my project, Fill Your Cup, today. So, greetings from the city of Mumbai, the capital city of state Maharashtra. A little bit of glimpse into my life. Who am I? This is how you mostly see me on Zoom calls. I'm a doctor. I'm an anesthesiologist, hence mostly stay inside the operation theater. I'm an armed forces personnel. I've kept the photo a little blurry because we are not supposed to be sharing it. I'm an avid traveler. I'm also a motivational speaker. I'm a professor. I have students whom I guide, postgraduate students. I'm also an author. I've written about 6 books till now. I'm a loving daughter. My parents have recently completed their 50th wedding anniversary. I am the better half in this equation, and I'm also mother of 2 teenage children. So, the problem statement for my project, Fill Your Cup, is that women keep their holistic wellness last priority. And I'm a very big living example of this. There was a time in my life when I was climbing the ladders of my career. I was a new mother. I had no clue regarding anything about parenting or how to be a new mother. And I was desperately trying to harmonize between my workplace as well as my household duties and responsibilities. And in this entire game, I wasn't able to keep up with my physical health. I had neglected my physical health, and I had just no clue regarding my mental or emotional health. And it took me quite a bit of time to come out of it and realize that even people who are as well read as me can keep their holistic wellness at bay because they're trying to manage so many things. What about other people who also may be actually neglecting or keeping their health as last priority? And maybe they could be women, could be men. However, I wanted to study more about women. What I proposed to accomplish was have a sample size, do a pilot project first, conduct literature review for finding out validated tools for assessment of holistic wellness, then create a robust curriculum, maybe conduct the training program over a period of time and conduct this pre and post questionnaire based study and assess. Now, what I managed to accomplish, I created a core group of 5 women and I interviewed them. This was suggested by my mentor. The reflections were collected, and on basis of those reflections, I actually could simplistically create a tool. Because whatever validated tools I got, none of them looked at the holistic wellness in totality. They were talking either about various mental problems. There were very few regarding emotional assessment, nothing much for the physical assessment. So I created a simple tool of 20 questions and I validated that tool. I have also conducted 2 sessions till now on 60 and 60 women. That means 120 women from different backgrounds. And I have conducted this pre and post questionnaire. Assessment still needs to be done. This is my timeline, and I've more or less been able to stick to it. I have conducted 2 sessions in January, and maybe this month I may be able to conduct 1 more. Now, what I'm still waiting, the outcomes, I need to evaluate. Evaluation still under process. However, what I would like to do as a long-term thing is create a replicable holistic wellness simplistic tool, and my robust training program, I need to make it replicable so other people can also actually do it. Conduct sessions for 5 more different groups of women coming from different backgrounds and ethnicity. Conduct session for men, equal number of men, because eventually I would also want to see what is the attitude of both genders towards holistic wellness. In the entire thing, what I want to really do is build sound, resilient attitude of women towards holistic wellness. And when I look at myself in this entire journey of the 4 pillars about authentic, inclusive, strategic, and impactful leadership, I did my own reflection. I also took feedback from my juniors, from my peers, and from my seniors. And the themes which came are, I'm more open to emotions now. I'm working towards relationship building where earlier I wasn't. I'm working towards leadership identity. I'm also learning to use trade-offs. I'm much more resilient. I'm now more working towards coalition and even using negotiation. I'm creating more support systems. I'm developing others, and I'm more open about it that I'm developing, because earlier I would do, but they wouldn't realize. I'm also able to handle the imposter syndrome better. I'm empowering teams. I'm making more allies and actually they're leveraging the power which I wasn't doing earlier. Savitribai Phule is my inspiration, and there is a beautiful saying, Mulgi Shikli Pragati Chali in Marathi. That means that if you teach a woman, you teach an entire household. And that's my entire idea with this project. Thank you for a patient listening. Thank you from the bottom of my heart. And this is my better half, I would say now, because he's been supporting me in everything.